And Elias is taking a much-earned break. It's Sue Smith with you. I've been here, well, it's coming up on 2 weeks now. I'll be here with you till Friday, and it's great spending the mornings with you. And in this half hour, we're going to talk about pets. Lots of you already lining up on the phone, so get your oar in, 514-790-0800. Some texts coming in as well. We've got Enid Stiles on the line. Enid's a veterinarian at Sherwood Park Animal Hospital in Beaconsfield. She also has a master's in veterinary behaviour medicine, and she joins me on the line. Good morning, Enid.
Good morning.
So I'm going to start with ticks, and this is a question that I was going to ask, and it came in on the text line as well. And Sandy asks, can you please demystify medication for dogs for ticks? How often do they need it? But also, if they're in the city and they're walking on the streets or maybe in a park, do we need to do that to our dogs if they're not out in the wild?
Yeah, great questions. And it is really the season for ticks. Pretty much any time we start getting warm weather, as early as March, we are seeing an abundance of ticks. And the problem with ticks now is that a lot of ticks in our area have Lyme disease and carry it and can give it to your dog. Of course, you can get it as well, unfortunately. And there's a few other diseases we see from ticks. One of them is called anaplasmosis. So these are pretty, dangerous diseases that our dogs can get. So the big question is, how often do we have to use these medications? Are they safe?
Mm-hmm.
So the short answer is now, with our very unpredictable weather that we see, that we are mostly recommending that dogs receive those medications every single month for the entire year. Or if you're using drugs that last 3 months, then 4 times a year, but that you continue to use them actually all year. We are having days in January and February. This year was maybe not exactly like that, but last year, where we were having many days over 0 degrees. And the ticks actually love to come out when it's cool. And all they need is a space underneath a tree where there's no snow, and they're going to be there, and that's where your dog's going to want to go to. So we're certainly moving towards discussing 12 months a year as prevention.
Wow.
And it's not, We've been saying that here at our clinic for about 4 years now. We've been really trying to encourage people to go as long as possible. And I think one of the big problems is that our, most affected seasons for ticks, where there's the most of them, is going to be early March.
Yeah.
And November, December.
When you're not ready, you're not really
anticipating. And people are not thinking, they're thinking, I'm going to go in for my blood test and I'm going to do that in April like I used to. But no, this is totally wrong. So even if you skip January and February, which are, in my opinion, the least, the months with the least risk, but there's still risk, but they're the least. But definitely March through to December are key. And then, of course, the medications that we have. So there's a lot on the market. There are some really old drugs out there, and some of them are actually more on the line of pesticides that are topically applied, and they work okay, but they're not safe for cats, and they're kind of yucky, and they don't do an amazing job for tick prevention. Mm-hmm. But we've been very lucky that in the past 12, 13 years, we have new line of medications which actually kill ticks quite quickly, but they're systemic, so they're given by mouth. There is a topical form as well, but it all goes into the body that is then driving the action of these drugs. And, we've been using them for so long now, and except for very rare incidents, which you'll see with essentially any medication, they're very well tolerated, very safe, and they kill the ticks quite quickly. So within 24 hours, so the likelihood of Lyme transmission is very significantly reduced.
And that question about living in the city, do you have to treat?
Oh, yeah. Yeah. So it's a great question, too, because I think that, again, this is sort of what do ticks like to do? Ticks are in the city because they come in through the birds and through other wildlife, so they're definitely in the city. And they like to be in anything. It could be like underneath a tree. It doesn't have to be high grasses. This idea of, my dog doesn't go into the country is like, it's not true anymore. We know that they're pretty much anywhere where there can be living type of, they're not going to be on concrete, that's for sure. But, my favorite example is dogs who love to walk on the sidewalk, but then they love to rub their back along that hedge next to that, and this is like prime tick, environment. So, although the risk may be less, obviously, than if you're in an area where there's a lot of ticks and a lot of wildlife, et cetera, but it's not zero. So most veterinarians in Quebec, whether we're in urban or rural areas, are recommending tick control.
And is it useful to try to take the ticks off by hand, like examine, what am I trying to say, examine the dog?
Yeah, so, we still want you to get those ticks off when they bite and they're on your dog. And that is because that although these medications, assuming your dog is on the medications, work really well, they're not perfect. And it's not nice. They can get reactions, dogs, just to the tick bite. So we do want you to remove them. You can look online for all kinds of fun ways to get ticks off, or you can also go to your vet who will happily give you a tick remover for free. They're just a little device that you can use to kind of rotate the head out and make sure the head comes out of the skin.
Okay.
I know, but it is good. Check your dog head to toe. And get rid of the ticks as soon as you find them.
All right, we do have some calls on the line which we want to get to, but
Sure.
I have a quick question before we break for traffic from Lola about how Lola can get her dog to stop shedding like crazy. Is there a way?
Oh, I wish there was the magic no shed
pill.
That
A
would
pill.
be so great. We have one for ticks. Why can't we have one for ticks? There's not too much you can do. First of all, a lot of shedding is seasonal, so they go through episodes 2 to 4 times a year where they'll shed out. Sometimes it's also related to stress or other conditions that can lead them to having a poor coat. So important that they get a good nutrition that is fully balanced. Another thing you can do is use omega-3 fatty acids. These are often from fish oils. This can help make the skin be healthier. And so if it is doing a sort of too quick a phase of moving through those hair follicles, maybe we'll make it happier and the coat will stay stronger and healthier. And then, of course, some dogs, depending on the breed, if we actually help them with blowing out their coat by doing special type of combing, we can actually have less time in which they're blowing out their coat, but they're still going to come out.
Right.
Poor thing. Sorry, bad news.
Can I just make an observation? I've recently started giving my dog omega-3, and she has fish breath.
Oh, yeah. It's a nice skin, bad breath. Yeah,
exactly.
So sorry.
And we're back with Enid Stiles on the line answering your questions about your pets. Enid is a veterinarian, behavioral specialist, actually, and she's a veterinarian at Sherwood Park Animal Hospital in Beaconsfield. And let's go directly to the lines because we've got lots of people waiting. But if you have a question, 514-790-0800. Let's go to Vanessa. Good morning, Vanessa.
Good morning. Calling in about my 1-year-old Bernese mountain dog. She's actually a patient of Dr. Stiles.
Oh.
Yeah, you know Coco and Kylie.
Oh, yes.
So we're actually having some trouble with Coco. She's fully housebroken. However, we are always waking up in the morning to Coco leaving us a surprise poop in the kitchen. She does not alert us during the night that she needs to go out, but it's almost every night, so I don't know if this comes down to anxiety or what's going on, but we are at a loss and a little frustrated.
Yeah, I bet you are. It's not fun, especially with the size of that dog. That's not a nice present to come down to in the morning. So, I mean, the first thing is always to make sure there's nothing medical, so to make sure that the poop is nice and firm and make sure that we're also making nice firm poops outside as well. Yes. Some dogs actually start to, kind of prefer to do it in a place either away from others when they're off leash. And sometimes that can actually be the toilet ends up being their home because they are not liking to do it outside for whatever reason it might be. So I'm always very much going back to basics and training. So retraining, so going out, making sure when they make their poo-poo outside that you're with them and you reward them in the moment and give them a treat in that moment, not just when they come back to the door. And really try and find what are her preferences to where she likes to go. And then once you got that and you keep rewarding that, then usually this behavior will lessen. However, in the meantime, as you're retraining, we usually recommend having them not have access to that area because you're not there, right, to tell them it's not the right place. So it's pretty easy for them to use it as their toilet because there's no way that you can see it in the middle of the night that they're doing it.
Yeah, and I feel like once they've gone somewhere they just keep going back to that, especially if it's a carpet.
It's always the same spot.
Yeah.
During the day, we have no issues. It's always overnight.
Yeah.
But okay, all right, good advice. We'll give that a shot.
Keep her from getting in there and just go back to basics. She's still pretty young, so it might just be a little relapse. And again, if there's anything wrong with the stool, then you have to let us know because we're your vet. And so we'll try and figure out if there's something going on medically.
Perfect.
Okay?
Thanks a lot. Have a great day.
Thanks for the call, Vanessa. You've got Enid Stiles on the line. She's a veterinarian at Sherwood Park Animal Hospital in Beaconsfield. Let's go to Manny. Good morning, Manny.
Hi, how are you?
Good. What's your question for Dr. Stiles?
I want to ask a question. Don't take it personal. How come there's a big difference in pricing from Ontario to Quebec, let's say for neutering a cat, from $1,200 in Montreal to $750 in Ontario.
For neutering a cat?
Neutering a cat. My friend was quoted $1,200 in Montreal, and I called my vet in Alexandria, Ontario, and I was quoted $750 with all the shots, with everything.
Yeah. Well, I mean, neutering a cat for $1,200, I'm actually pretty shocked, because I've never. Cat neutering it's still a veterinary procedure, but it's one of our more basic ones, and most clinics are trying to keep it at a decent cost so people can afford it, so that we don't have cats running around mating and creating babies everywhere. So a few things to think, and this comes from pricing in general. So aside from it being just that particular surgery, but just in general, why there are differences. And that can be many, many reasons, but probably the biggest one is, how much does it actually cost you to run your business? And when you're in the city versus in a suburban area or in a rural area like Alexandria, the price of actually running your business is less. The people are paid less. Your accommodation, so the rental or your building, is costing less. Everything costs less when you're outside the city. So right there, you can, drop costs by 20 to 50%. Sometimes it's that significant. So that's probably the bigger thing. And then sometimes also you just want to make sure you're actually comparing apples to apples. So in some cases, you actually get to meet the veterinarian. They're going to do the exam. They're going to do the vaccines. They're going to have a discussion with you. That is worth something. Whereas some spay-neuter clinics, they're doing it very low cost. You're not going to get to speak to the veterinarian. Basically, they're going to go in, have whatever basic vaccines, very brief exam, and get spayed or neutered. So just to remember, there's a difference in the service that's provided as well, often in those cases.
Okay.
So that's probably explaining a lot of it.
We're going to leave it there, Manny, because we're coming up against the clock, and I want to get to another caller who's been waiting patiently for a long time. Thank you, Manny, for that call. Sonia, do you have a question for Dr. Stiles?
Yes, I do, actually. It's for ticks, and I am very close to Alexandria. That is my veterinarian for Pippi Longstocking. She's a gorgeous border collie, and I've just recently let her off leash, but it's the tick situation. I'm on a 20-acre farm.
Yeah,
so
sure.
I have to let her loose. I mean, she's a border collie. That's why they call them border collies, because they stay on the border, hopefully. However, I gave her her last tick treatment was on her birthday, April 30th. But now I hear there's a new shot that they can be given, and I don't know how long. It's a shot, like a needle.
Okay, so Sonia wants to know if there's a different treatment than the one we talked about before. Thanks for the call, Sonia. Enid, what do you know about that?
Yeah, so I'm not aware of an injection here in Canada anyway that's been approved for ticks. There are, however, some longer-lasting tick medications in the same family as the one that's given monthly but last 12 weeks. So that might be an option for people who have a hard time remembering to give it every month. But really, those are the best options, is the medication that's given, either orally. A couple of them, like I said, can be given topical as well, but they're still systemic, like drugs that work inside the body. They're not pesticides.
All right, let's go to Pina on the line. Pina, you have a question for Dr. Stiles?
Hi, good morning. How are you?
Good morning.
My question is more general, and it's about the issue we have of stray cats here in Montreal. So I want to ask the doctor if you ever heard of the program TNR, Trap, Neuter, Release.
Yes, absolutely.
Okay, so my question is this, because I did it for a little while. I'm in the East End, and the only place that I could bring the cats we trapped was in the SPCA in the Carry. So it's, and we have to bring them, pick them up, and release them. So my question is, have you ever been or heard of if the government or boroughs can subsidize, give money to the veterinarians in our area closer to home, that more people can do this, so they could maybe trap in East End and bring to a vet and have a program with the government? I'm just curious if
good question. Good question, Pina.
Brought up to the vets.
Yeah.
Because it's a big issue, and I mean, I did it for a few years, but it's time consuming, and I work, we eliminated an issue in my area because we had a lot of cats, but now I'm starting to see them coming back and more stray cats. So it's sad to see this going on and getting worse.
It's a great question, and I appreciate the time that you've committed to helping those cats and your community. There are some cities who actually have gone to their boroughs specifically and received funding, and it has been local veterinarians in those areas that have done that. So it does sometimes exist in some places within the Montreal area. So the best thing to do is to go to your council representative and say, this is a problem, and is there anybody that has approached you? And then, build the program like that. They're probably not going to do it on their own unless there's sufficient complaints or issues with the stray cats themselves. So, but absolutely, that is a mechanism to help with TNR programs. I think the other big thing is that we just really need to be more responsible with our cats. They just should not be going outside, and they all need to be spay-neutered. And that's kind of the backbone behind, because TNR programs are great, but they're not the answer.
But I mean, may I just follow that up with a question? Because I know it's an endless debate about whether they should be going outside, but I mean, isn't it cruel also to just keep a cat inside all the time?
Yeah, and it's such a controversial issue, and I feel really everything is pulling me in every direction on this issue, because I also feel that a lot of cats are often quite, stimulated outside, and they see the world, but the risks outside are enormous for them. The other big thing, which we don't talk about a lot, but it is a very real problem, is that these cats are actually killing a lot of our wildlife.
Birds especially.
Yeah. And this is, they have decimated populations of birds on islands and things like that. We just know it's really actually a real problem. So thinking out of the box about the welfare of not only our cats, but also the welfare of the other animals in our environment and our communities, please reconsider having your cat go outside. But I absolutely feel it both ways.
Yeah,
I'm not judging anybody that lets their cat out. As long as they're well vaccinated and sterilized, at least there's that. But yeah.
All right, we're going to end it on that note. Enid, thank you so much for joining us today. I really appreciate it.
You're very, very welcome.
That's Enid Stiles. She's a veterinarian at Sherwood Park Animal Hospital in Beaconsfield. She also has a master's in veterinary behavior medicine, and she was answering all our questions today. Thanks so much to all the callers and texters who texted in.